Hi friends, this is Dr. Govinda. I'm a surgical oncologist and we have a hospital in Trichy. After this corona pandemic, we were desperately looking for some disinfection methods that can be employed in hospital and as well as for the household articles. In the hospitals, we were actually looking for something that can disinfect the N95 masks so that we can reuse them. Of course, N95 masks are supposed to be disposable. But in a low economic setup, it is not practically possible for us to dispose the N95 masks. That is why the WHO Center for Disease Control Protocol has been recommended. I think most of the doctors will be following that, where we follow a rotation basis of N95 mask usage. We give 5 masks each to the healthcare worker and they use it for consecutive days. And once the 5th mask is used, they come back to the first mask. This is the general common protocol everybody is using. But the disadvantage with that is we have to keep that unused mask in an open atmosphere so that it gets exposed. At the same time, dust also gets settled on that and it is visibly soiled after 1 or 2 exposures. So then we were looking for some other better method, and the WHO recommends ultraviolet sterilization. So what they call it as UVGI, ultraviolet germicidal irradiation. There are certain commercially available products which can deliver this UVGI, ultraviolet germicidal irradiation. And this has been recommended for N95 masks because they don't hamper the filtration mechanism of the N95. This is one on the hospital side. On the domestic side, we are very much confused how to handle our day-to-day products like vegetables, the milk packets, and the gadgets that we use, the mobile phones, the spectacles, the watches, pens, the currencies. All these are practical problems, and I don't think there is any standard recommendation for disinfecting these to protect ourselves and our families from the COVID pandemic. So this is where ultraviolet technology plays a very important role, and we were discussing about that, and we were looking for the various products, and we have come across. I personally use one brand called UV Spectra, and this has got a lot of advantages because number one, this product has been developed by a group of doctors, so they have taken special consideration into the efficacy and safety of the device. And you all know that the ultraviolet technology, it works on the wavelength of the ultraviolet rays. So ultraviolet is ideally disinfecting in the wavelength of around 200 to 300 nanometers only. So that is the maximum benefit we get. So this falls in the UVC category. So this particular ultraviolet device that I'm talking about, the UV Spectra that we are using, that delivers an wavelength of 253.7. So that is very much within the effective wavelength. So this belongs to the UVC category, and that is what has been recommended by the WHO for the disinfection. And the bulbs that are used in this device are 11 watts bulb. So as the watts increase, the energy increases. And so naturally the exposure time decreases. So you need not keep them for a very longer period of time. The ideal recommendation for disinfection is somewhere around 2000 to 8000 microjoules per centimeter square. With the 3 bulbs, this particular device UV Spectra is using 3 bulbs, each of 11 watts. And so the total energy is very high. And so a very short duration of time is required. So this recommended dosage of 2000 to 8000 microjoules per centimeter square, that can be achieved within 5 minutes using this device. Whereas when you go for other products that have lesser wattage bulbs or less number of bulbs, then you will have to expose them for a longer period. When you expose them for a longer period, what happens? The burning hours come down. So, and as the wattage increases, the burning hours specified by the company is also increased. So the 11 watt bulb has 9000 burning hours time, and it requires very shorter exposure time also because there are 3 bulbs used in this particular device. So that calculates to be a very good advantageous position. That is why I've been using this UV Spectra brand particularly. And the other part is the bulbs, because we know that the ultraviolet disinfection method, for it to be effective, it has to directly fall on the surface of the object that is going to be disinfected. Otherwise, unlike the heat or autoclave, it cannot percolate through the materials. It has to only do a surface sterilization. So ultraviolet rays have to directly fall on the objects that we keep inside the chamber. This has been particularly taken care of by the doctors group that have developed this UV Spectra device, because they have strategically placed the bulbs in different planes so that the entire chamber gets the ultraviolet ray distribution. And another thing that has been done is instead of keeping trays of stainless steel or grill, which is there in commonly used products, this particular brand has been modified where they have transparent shelves. So the UV light passes through the entire chamber in all the 360-degree directions, and the entire surface of the object that we keep inside gets sterilized. So this is another advantage. And then the next thing is the safety. Regarding safety, this particular brand, the UV Spectra brand, has got a relay switch. So once you open it, automatically the UV bulb shuts off and a normal LED light burns. And once you close it, the UV light comes on automatically. And the machine has an optional timer device also. So you can fix it and it will automatically turn on and turn off when you set the timing. The ideal time for this particular machine can be anywhere between 5 to 10 minutes. That is more than enough, because there are 3 bulbs of high wattage, that is 11 watts, and the exposure time, because the energy that is required to sterilize depends on the exposure time. And this particular device needs less exposure time. It can achieve that energy level that is required. And the other safety concern is malignancy, because people may be worried that ultraviolet rays can cause cancer. And I'm a cancer specialist myself. In the ultraviolet category, the UVB radiation is known to be carcinogenic. That's what causes cancer. And particularly the UVB rays that fall in the nanometer range, that of 390 to 420 nanometer wavelength, they are very much prone for causing cancers. But here in the UV disinfection chambers, what they are using is only a lesser wavelength, that is UVC. UVC category does not have that much of malignant potential, but even then there should not be any direct exposure, because it can cause skin irritation or eye irritation. To avoid this only, they have got a relay switch that ensures absolute safety. So that is a very good advantage of this machine. The long burning hours, the high energy, the strategically placed bulbs in different planes, highly reflectile surfaces inside, and the transparent shelves that can transmit the rays all over the entire chamber. All these are special advantages, and particularly a microbiologist is also involved in this team which has developed this machine. So that is why I'm using that. And I feel absolutely safe with this device, and I'm using it in the domestic setting. I'm using them for keeping the milk packets, the vegetables, and then my mobile phone, the watches. All these things can be kept, the credit cards, currencies, coins, all those. So this particular chamber, I would recommend this particular brand, UV Spectra, because this is unique from the other products in the market. And we can be quite confident about both the safety and efficacy of this device. So I hope this will help you to decide on what particular UV machine that you are looking at, because you will have to look at the watts, the positioning of the bulbs, the number of bulbs, the exposure time. All these matter while deciding about which device you should go, because there are plenty of ultraviolet chambers in the market with different shape, different sizes. I hope my experience will help you in deciding about what sort of ultraviolet chamber that you are looking for your use. Thank you.